Good afternoon, everyone. This is UICC in Geneva. Good morning, maybe to some, depending where you're dialing in from the world. Welcome to the WHO and UICC introduction to the new Global Report on Cancer. We thank you for joining us today. I'd just like to give you some administrative details before we get going. We don't have a live chat function, unfortunately, today. We've had some technical challenges, so we encourage you to add your questions at any time in the chat function, which if you look at the bottom left side of your screen, you should be able to see. If you are only dialing in on an audio line, you are quite welcome to send questions to advocacy@uicc.org, and we will be tracking these and feeding them in to the conversation as we move forward. We recognize that some of this is new information to you, so if you don't have questions at this point, feel welcome to send your questions or thoughts later following the following the call today. We'll be doing some follow-up calls on this topic, so this is really just the first kickoff. So my name is Julie Terode. I'm the Deputy CEO and Director of Advocacy and Networks at UICC. So I'd like to kick off by saying thank you to WHO for giving us, as a cancer community, this opportunity for an early consultation on the Global Report on Cancer, which we really hope to be a report that's going to drive national action and be a fantastic tool for us as a cancer community for driving activity moving forward. So just to provide some context for you, I'm sure most of you are very familiar with this story from 2011, the high-level meeting in New York, which was a pan-UN meeting calling for global commitments on NCDs. We've moved throughout the following few years, firstly getting an accountability framework, including targets and indicators, which was very useful for cancer. We have a global action plan, which runs through to 2020, and WHO has formed a global coordinating mechanism to bring stakeholders together. We've been working over the last few years with your help on access to essential medicines, technologies, and looking really at trying to track progress as we move forward. But most important was this year with the implementation or approval of the cancer resolution in 2017. So we're really looking at what are the deliverables against that resolution, and the Global Report on Cancer is very much one of them. So it's your opportunity today to hear about how WHO is envisaging both the timeline and the opportunity to engage in this process. And we know for sure that this is an important lever for progress by 2025, and particularly linkage into the Sustainable Development Goals as we move to more of a 2030 perspective. So before we secured the resolution, we were asking, we were pushing for the resolution really around these three key issues. We're seeing increasing burden of cancer, and in fact the 212 and 216 data show a slightly larger increase than was predicted. We haven't seen any discussion of cancer for 12 years at the World Health Assembly, and we thought it was well time for an update. We wanted to link into those key targets of 2025 and 2030 in the UN agenda and make sure cancer had a good share of voice there. And we also wanted to have a very clear mandate for the WHO team. What is the technical support that member states really want to push the agenda forward for cancer? And we particularly wanted, as UICC, to focus on the access issues that we know all patients are struggling with, but particularly those in low and middle-income countries. And I don't want to dwell on the content of the cancer resolution today, but I think when you look at that document, you can see that we really have answered many of those questions, and we can sort of put a tick against a lot of those issues. Maybe just from my perspective, I'll pick out a few key new items in that text that you can really harness in your own advocacy. If we look at the burden data, it's the first time that WHO has emphasized that cancer is the second leading cause of death in the world. We've often seen a breakdown of different cancer types such that cancer doesn't feature very high in the mortality list. So I think it's a great single message to really galvanize some of your governments behind taking action on cancer. It's also the first time that WHO has really made an emphasis on the morbidity associated with cancer, disabilities and other issues. And that's particularly important for people living with cancer. And I really like the emphasis and the sentence in the document saying that cancer is a growing issue of public health concern. Again, really trying to raise the urgency and profile for addressing cancer now rather than putting it off. For those focused in health information and prevention, this is the first time also that a WHO document has actually captured the fact that we can prevent approximately 50% of cancers. That 50% figure not having appeared before, and I think again for those working in this area it's a really important piece to emphasize when you're working with policymakers. And so what are some new things in the text? Well, I'm really happy to see that the text addresses inequalities in terms of global inequalities, but also in terms of interventions throughout the document. And we're very pleased to have seen the reference to children and young adults with cancer in that document. As we know, it was really quite lacking in the Global Action Plan on NCDs. We also like the emphasis on scale-up to national population-based programs, the focus on evidence shaping those programs, and the focus on quality of services. I think this is really important in driving impact in a sustainable manner. And we also like the renewed emphasis on the continuum of care for cancer and renewed emphasis on pain and palliative care, but also bringing in the topics of rehabilitation, survivorship and follow-up care, which we all know are very important for cancer patients. So I do encourage you to read the document, and I also encourage you to think about cross-referencing that document to another key piece of information that was approved at the World Health Assembly, which was the best buys or the Appendix 3. If you cross-reference those two documents, you can see there's some real synergies in messaging to support the policymakers' decision making, and knowing that not only are the interventions you're pushing for important, but they're also highly cost-effective recommendations. So I won't go through the details, but there are opportunities both on the side of prevention and early detection, linking that into treatment and care, which I think is a very important message for us to get across when we're talking to governments and policymakers in particular. So as we move forward from the cancer resolution in 2017, there are a few new documents that WHO is committed to delivering. One on the investment case, one on access to cancer medicines. But what we're talking about today is the global report on cancer, and I'm very happy to hand over to Dr. Andrea Bowie, who will give us an introduction, explain what that document is intended to be used for, and also talk about how we as a cancer community can get involved. So welcome, Andrea. Thank you for joining us, and over to you.
Thank you so much, Julie, and warm greetings to many friends and colleagues. Just looking at the list of participants, I see some very familiar and dear colleagues. Before starting, I want to acknowledge the importance of having this community that is emerging. When we reflect on the success of WHO reports, what has categorically been shown is that the success of the report really hinges on the involvement of key stakeholders. So this is the beginning of our journey together. It's about a 1.5-year process for us to develop this report, and we want you to be part of this from the beginning because really this is intended to be the voice of the larger cancer community. So to begin, let's perhaps spend some time reflecting on the different elements of this report. First and foremost, why now? Do we really need another global report? And if so, what is it intended to accomplish? And then to follow that with what is the exact content that we anticipate this global report will have? After spending about 20 minutes addressing those questions, we'll follow that with a question and answer. Our hope here is, in spite of the limitations to not be able to have a discourse, we do hope to receive some questions from those listening and to be able to engage in a larger dialogue as to what do you think should be the content of the report? Where should we be going with our key messages? Afterwards, I'll spend about 10 minutes talking about how can you get involved, and then we'll finish it with an additional 10-minute question and answer session. So why now? Those now on the call don't need further clarification, but still around government halls throughout the world, we find that the cancer message still hasn't taken full hold. Perhaps one easy way to explain it to policymakers is just to say, in a high-income country, about 1 in 2 males will get cancer in their lifetime and 1 in 3 females. That is a very stark statistic as we think about our communities, our loved ones, and our families. And that really puts cancer in the minds of policymakers, realizing that this is not just a disease problem, this is a population issue, and public health measures are needed to address public health burden. And in spite of the burden being lower in low and middle income countries, it still is quite a prevalent disease. About 1 in 6 men in East Africa will be diagnosed with cancer in their lifetime, and that number is expected to increase over time. If we look at the mortality statistics, again, we see how profound the burden is. About 1 in 6 deaths throughout the world is due to cancer. If we were to sum up the total number of deaths from HIV/AIDS, TB, and malaria combined, and then multiply it by 2, that would be still lower than the total number of deaths related to cancer. And what's most problematic is the likelihood of dying of cancer is very dependent on where you live. And this for us at the WHO, as Julie mentioned, is an issue of equity. And we see that public health can address issues of inequity. And this is again where we see this global report highlighting key messages. If we were to take 2 countries as an example, Germany and Ethiopia, both of which have similar starting populations in 2015, and we were to map out how many breast cancer cases we see those 2 countries having in the next 75 to 100 years, you can see that in Germany, the number of women who will be diagnosed with breast cancer is quite stagnant. But if we compare that with Ethiopia, you can see the profound difference in the next 50 to 100 years. It's about a 5-fold increase. And the reason this is relevant is not just to say what a significant increase, but also to have to envision a health system that is able to absorb that increase in breast cancer cases. That means 5 times the number of providers, 5 times the number of medical schools, 5 times the number of hospitals, 5 times the number of radiotherapy machines. And if we start to envision it in those terms, we can start to see how much work we have to do to really care for the increasing number of people who are being diagnosed with cancer. And to make matters even more complicated, our starting point is quite far back. If we look at global health financing, on the far right we see where global health financing is directed. And when we compare HIV/AIDS to non-communicable disease, we can see exactly how stark that contrast is. Cancer, as one of the 4 NCDs, receives a very small percentage of total global health financing. So recognizing this, we have to start to envision where we can succeed and how this global report on cancer can give us that roadmap for success. Just to show how much of an impact public health can have, this is a slide that shows the trends in deaths in low and middle income countries between 2000 and 2015. If we look at vaccine preventable infections that result in subsequent death, we can see that in 2000 there were about 1 million deaths due to vaccine preventable infections. If we track it only 15 years later, we can see it's been reduced by about 74%. That is a major public health success. And as we look across the communicable disease community as well as neonatal conditions, we see that trend of decrease happening across the world. But when we contrast that with non-communicable diseases, we see the challenges that we are now encountering. Breast cancer cases in low and middle income countries up 32% in the past 15 years alone. Lung cancer now over 1 million in low and middle income countries. And when we look at NCDs in total as compared to infectious diseases in total, there are 6 times more deaths from NCDs than there are from communicable diseases globally. So this was, as Julie mentioned, a landmark year for cancer. This resolution really is a renewed mandate for WHO and for the global community to say, these are our priorities moving forward. The resolution was passed with widespread support. 18 countries co-sponsored it, which is a significant number when we reflect on WHO resolutions. And more than 40 countries spoke in support. There was broad engagement and support from the civil society community, including UICC, as well as the European Society for Medical Oncology, as well as colleagues from the palliative care community, all who spoke in support of this resolution, and we cannot understate your value. Civil society has a very strong voice, and their contributions to this resolution are surely significant. The resolution itself, as Julie mentioned, is only about 6 pages, and it really is a worthwhile read because, in fact, all the words were deliberated on with great intensity. And these words reflect the perspectives of governments around the world. This, for us, is the roadmap that they are telling us we must follow. And WHO is a member state organization. That means that what we do, how we do it, and when we do it is all dictated by governments. So now they've given us this instruction manual to say this is what we want you to do for the next 5 to 10 years. Resolutions feed into a larger WHO agenda, and without spending too much time on the slide, just to show that resolutions in fact impact everything from our program of work to our budgets and our work plans. So this resolution really is a landmark accomplishment for the cancer community. Now if we look at the specific composition of the resolution, what we're here to talk about today is one specific item under the request for the Director General. That's paragraph 7. If we look at it in greater detail, at the bottom of the slide, to read verbatim, it says, to develop before the end of 2019 the first periodic public health and policy-oriented world report on cancer in the context of an integrated approach and based on the latest available evidence and international experience, covering the elements of this resolution with the participation of all relevant parts of WHO, including IARC, and in collaboration with all other relevant stakeholders, including cancer survivors. If we were to break that down into 3 parts, the first is, say, the timeline, first and foremost. 2019, you can see the date, but also critically to note that it's intended to be a periodic report. So it's not just 2019, but recurrent publications thereafter. Next, the content of the report, they give the overline. It is a policy-oriented, evidence-based report that looks at cancer through the lens of an integrated perspective. That is prevention relating to control, cancer relating to NCDs, management relating to universal health coverage. So nothing is viewed in isolation. And also partners. Partnerships really are critical, as you can see from the resolution itself. We're asked to work with all parts of WHO, including IARC, the International Agency for Research in Cancer, our specialized cancer agency based in Lyon. And asked us to work with IARC. Unfortunately, IARC couldn't join the call today, but they are 100% co-leads and partners in the development of this report. And to work with all other relevant stakeholders. This includes civil society as well as other UN agencies. I'm very pleased to see that our colleagues from IAEA are also here, because we see our UN colleagues as well as civil society as absolutely critical to the success of this report. Now, we understand perhaps why a report is needed, but if we can give a bit better context as to the actual impact that these reports can have. The intent is really to set a global agenda for the next 10 years, to engage and mobilize stakeholders towards that agenda, to augment political commitments, and to influence policies and programs. If we look at other WHO reports for our guidance, an example we can bring up is the World Report on Violence and Health that was published about 15 years ago. We saw that over 25,000 copies were requested, mainly in low and middle income countries. It was translated into 14 languages, again reflecting the broad communities that wanted to better understand how to address violence and health. Over 60 countries organized high-level policy events, the type of launch event that I'll discuss a bit later on. But just to say, these are events in which governments were present, high-level decisions were being made, and the promotion of violence and health was being viewed in a unique way because of this report. And furthermore, at the end of this report, it launched an international partnership, the Violence and Prevention Alliance. These are the types of impacts we want to see the WHO global reports having. And if we look at other reports that, again, we can see this is the case. Here in the World Report on Road Traffic Injury Prevention, we can see the former UN Secretary General Kofi Annan. We can see heads of state. We can see major meetings all happening because of this report. And this is how we envision our global report on cancer proceeding, to have a global representation and a global impact. We can see the impact on communities reflected here in the media reports from various reports in different languages, again showing the broad impact of the WHO reports. But not all reports have an equal impact. If we compare, for example, a global tuberculosis report with a global status report on alcohol and health, both were WHO reports that were published in 2014. But you can see that there's a 30-fold increase in the science impact, or the citations seen here from Google. So at WHO, we spent a little time internally as a team reflecting on what are the predictors, why are some reports more effective than others, and how can we ensure that our report is successful. We came up with 3 principles of success. First and foremost, content. The content must be as forward-thinking and innovative, yet simple, because we have to remember our target audience. The target audience here are governments, policymakers. They may not be able to read a 200 or 400-page report with extensive science. What we need are very clear instructions, very clear message, but at the same time also present new perspectives, new data, because really that will also bring in a new visibility from partners outside of the cancer advocacy community, people that may not understand cancer, but we can present to them information in a new way, bringing them into the dialogue. Step 2, as a principle of success, is to think about the process. Not just a report as a document, but really the document itself is but a small part of the larger process that needs to be considered. And in order for this to succeed, again, it requires engagement from all stakeholders, from those on the phone and from those that we normally don't think of when we think of cancer control, ministries of education, ministries of finance, partners around the world that we are asking to now consider cancer as a public health priority. Engaging them early in the process, throughout the process, and then in the dissemination really can ensure that the report has more of an impact than just another publication that comes from the WHO. And finally, that concept of engagement really is key. We need to be broad, we need to be inclusive, and it must be present throughout the process and beyond. A couple other small lessons that we gleaned from our review is to consider spin-off products, because again, we don't expect everyone to read a 100 or 200-page report, but we can look at partners and ask, perhaps we can use an infographic as a way to capture the key message, or video material to communicate a story. And those in fact can have a huge impact to disseminate the key messages from the global report. And also, translation really is important. Our intent isn't just to speak to an audience in one area of the world or one language, but for this to be an international report. So what will this report contain? Perhaps the best way to frame it is by reflecting on the aim and the target audience. The overall aim is to raise awareness about cancer as a preventable and controllable public health priority globally. To simplify that, simply stated, it is to invest in cancer control as a means to save lives and as a means to improve efficiency in health systems. What we're hoping to accomplish is to set the agenda for accelerated action on evidence-based and comprehensive cancer control programs. This is a 10-year forward-thinking agenda, not what are lessons from the past 30 years that we should be rehashing. Really, what are new strategies that we can consider as we look to address the growing cancer burden? The audience here is predominantly policymakers, governments, etc. But we also think of it in the larger context of decision-making, which includes policy influencers, those that have voices in halls of government, and also civil society at large. We want to see this report be relevant to more than just decision makers, but also to people throughout the cancer community, implementers, media, industry, academia, and civil society. And using that inclusive strategy, we want the key messages to relate to each of those groups in a meaningful way. What will the general scope of the report look like? We could break it down into perhaps these 7 different points as an entry for further discussion, but to start, the first point will be to present the burden, trends, as well as the social and economic impact of cancer. Followed by describing effective strategies to mitigate risk factors, what are known and novel ways of preventing cancer, how to provide up-to-date evidence for programs with a focus on equity and access, as Julie mentioned, really recognizing the huge variation in cancer outcomes depending on where you live and your ability to access care, to inform priority interventions and the rational allocation of resources, to promote universal health coverage through the selection of a resource-appropriate cancer control package, to highlight population-based cancer registries, and to draw attention to cancer research as a public health need. This report won't be developed in isolation. As mentioned earlier, it's intended to function within an integrated lens. And what that means is that we want to bring in key messages from other work streams. An example here, I'm pleased that Dr. Ginsberg is on. She led the Lancet series on women's cancers, and that's an exact type of mechanism that we want to look at. How can we use women's and children's health as an entry point for cancer messaging? How can we look at the UHC agenda and think about novel ways of promoting cancer prevention and control? What is the investment case? How can we ensure that out-of-pocket payments are reduced? And what lessons can we learn from other groups that are looking at financial protection across all disease categories? How can we build a trained workforce? Lessons that are true not only in cancer, but may be true across other health topics, access to medicines, and aging populations, all very relevant and important global movements and global strategies. How can we link our report with those strategies? Also, people often ask, how will this relate to the IARC World Cancer Report? This is a publication that IARC has produced. The most recent one was in 2014. Our intent is to coordinate it fully. As I mentioned, IARC is a co-lead in the development of this global report. They're part of the Secretariat. And our intent is for the global report, the WHO global report, to really focus on the policies. The IARC World Cancer Report, as it has in the past, will provide the scientific foundation for where those policies have driven from, and what other research gaps exist for us to develop new ways of addressing cancer prevention and control. The table of contents can be looked through 3 different core sections, although this table of content, I should preface this by saying, is still under discussion, and again is part of the teleconference today. We would like your feedback. What are some of the key elements that should be included in our table of contents? We've broken it down into 3 sections. The first is to start with making the case. Why is cancer a public health priority? Second, how can we interpret the evidence? And finally, how can we implement programs effectively? The first one, again, will highlight the elements of burdens, trends, investment cases, etc. That will be followed by a better understanding of what are evidence-based programs and policies for cancer prevention and control. For example, what is the role of early detection within cancer control? And how can we promote treatment and palliative care for all? And then finally, within implementing programs, what are the health system considerations that need to be made? How can we finance programs and reduce financial harms to individuals and communities? What is the role of National Cancer Control Plans, or NCD, multi-sectoral action plans, monitoring and evaluation, quality assurance systems, as Julie had mentioned? And also to include the need of partnerships and advocacy in cancer control and prevention, focusing on patients at the center of care. And finally, in this section, to include a discussion on cancer registries and research. So perhaps we can pause here and open it up for discussion. I put 3 questions here that we can reflect on, but really, given the format for today, we invite you to list the questions in the participant feedback, and Julie and I and others that have the speaker function can perhaps reflect on the questions that are raised.
Thanks very much, Andre. That's a great presentation, and thank you for the work that the WHO team has done to really analyze past reports and learn from them at this early stage, so we can really try and make the best of this process. And I like the fact that you underscored that it is a process. It's not just creating a report and forgetting about it. You know, how do we harness that as an advocacy community? And I really like the fact that member states have asked for periodic reports, that we know this won't be the only report. We can build on that moving forward. I do have a couple of questions that came in from people that couldn't join today, so maybe I can start with those questions. And if people on the call do have questions, either send an email or use the chat function in the bottom left of your screen. So, Andre, there was a question from World Cancer Research Fund who couldn't join, and they said, you know, would this report really be able to emphasize all of the risk factors associated with cancer, given the 50% target that we're talking about that could be preventable? You know, how can we emphasize risk factors beyond tobacco? They still feel that tobacco is the only risk factor that member states really think about connected to cancer. What's your views on that?
Thanks, Julie, and thanks to our colleagues for that important question. As many on the call know, the NCD movement has focused on the 4 major risk factors that are shared amongst the NCDs. And we see that that is a very important starting point in the larger dialogue on how to reduce morbidity and mortality from all NCDs. But as the question alludes to, there are some very critical specificities in cancer prevention. And we see that, for example, in the communicable disease risk factors, which can constitute up to 25% of cancer cases in low and middle income countries. So how can we bring in the policies and programs beyond the standard for non-communicable disease risk factors within this larger dialogue on how to reduce the cancer burden? When we discussed this with our expert consultation, we found that we do need a dedicated section that is inclusive of cancer risk factors, so that we discuss not only tobacco, which of course is an absolutely critical one as it is responsible for about 20% of all cancer deaths, but we also need to be thinking about new risk factors in terms of population control that previously we hadn't been focusing on too much. An example that often comes up is gastric cancer and H. pylori, or perhaps HPV vaccination that we know is such an important way for us to address the cervical cancer burden. We anticipate that our report will mention these policies to examine what data exists, and that again aligning with the IARC World Cancer Report, but also to think about policies and programs that have been tried in other countries, so that we are inclusive in how we view the prevention, recognizing that if we only focus on those 4 risk factors, we may be missing up to 25 or 30% of cancer risk factors that wouldn't be traditionally classified under the 4 common risk factors.
Thanks, Andre. We also have a question here from Jim Cleary, who's joined the call. He's saying palliative care is very important within cancer, and I can only agree with that. Colleagues in Ghana are only recently telling me that 90%, if not more, of their palliative care patients are actually cancer patients. But Jim's also asking, can you give some detail of the interaction with non-cancer palliative care information and documents? How can we build that into the cancer report, and particularly link to the palliative care resolution and some of the supporting documentation that's already been worked on by WHO?
Yeah, and Jim, thank you for both joining the call and for your question. Palliative care, as Jim knows quite well, is really an important priority for us at WHO. It's been reiterated by member states in multiple settings, and as you mentioned, Julie, most recently in the palliative care resolution from about 3 years ago. We see that within our report, our hope is to highlight what are key considerations in palliative care, again, using the platform of cancer not as the point of reference, but as a point of discussion. And that's true as we see in pathology as well. The way we want to position the cancer report is to say, what are palliative care strategies that work across the board, not necessarily specifically for cancer, but palliative care strategies that work in other diseases that we can learn from. Perhaps we can learn from the HIV community that has had some success integrating palliative care into the community. So those models of service delivery is really the focus. We're not trying to give a stepwise approach for how to set up a program, but more importantly, what are service delivery models that would be relevant for health planners. And as Jim knows quite well, there are other work streams from WHO that we're hoping to link to this report, because we really see this as a platform for consolidating existing WHO guidance in different work streams. An example is our current work on the investment case for cancer, as well as our current work on health workforce for cancer control. We see this document as a platform for us to communicate with the larger world some of those work streams, some of the new findings. And in palliative care, as Jim has also been quite engaged with us, we're trying to now reevaluate palliative care guidelines. So we see this discussion being able to bring in a larger discourse, not focus on a specific area, pathology or flow cytometry as it pertains to cancer, but to larger health system discussions. And I think palliative care is an excellent example of that.
Thanks very much, Andre. And I think the biggest challenge is to really cover all of the key areas in 100 pages. And so perhaps we can talk about the process moving forward, particularly thinking people on this call, how can you respond to some of the questions that Andre's already posed? How can we bring in new good examples of successes and good progress and best practice? And how can we learn from those for advising policymakers in the broader context? So maybe you'd like to continue with your next section, Andre?
Yeah, that sounds excellent, Julie, but perhaps just one brief comment on what you raised, and I think that it's actually quite critical. The concept of best practices, as many on the call know, when we actually look at evidence-based policies and programs that are specifically performed in low and middle income countries, we have a significant deficit. For example, early diagnosis strategies in low and middle income countries. There are a very limited number of published studies on looking at intervention specifically. When we think about the report, we know that doing a summary of available evidence won't be enough. We want to be able to use best practices in case studies. So we do invite people, if there is an area in cancer prevention and control in which you know of a success story, please feel free to share that with us, because there will be multiple opportunities either within the document itself or in the spin-off products for us to highlight some of those success stories. So just to acknowledge what you said, Julie, and perhaps invite our partners to share with us those success stories, because they will be very relevant to us defining best practices and advancing the agenda. So this last section, perhaps spend about 10 minutes looking at how can we get involved. How can you, both on the call now and in the future, be involved in this discussion. To start, perhaps by framing it through, again, the importance of partnerships. The resolution itself reiterates the need for partnerships multiple times. I believe it's stated at least 10 different times within the operational paragraphs of the resolution that we are being asked to collaborate with partners. Here we see as one of the requests from governments to WHO that they would like us to collaborate with non-governmental organizations. You can see the list of other partners for the realization of the Sustainable Development Goals. If we look at it within, again, the specific mandate for this report, the last sentence says, again, in collaboration with all other relevant stakeholders. So where are we now, and how can you get involved? If we look at the process, we've broken it down effectively into 3 phases. The first is the preparatory phase, then drafting of the report, and finalized with the dissemination. Each of these phases has multiple components. The first, looking at the preparatory phase, began with a consultation of experts and all stakeholders. This is part of that process for us. And again, I'm most appreciative of the participation of those on the call today, as well as those that have followed up with questions remotely. The next step will be the actual initiation of drafting the document itself. We will develop technical working groups and editorial committee and initiate the actual writing of the document itself within the next 4 to 6 month window. This will then undergo expert review, and our plan within early fall of 2018 is to initiate a process of regional consultation, because we must make sure that our report is relevant to the end audience, and that is, again, policymakers, governments, ministries. So the intent is for us to have a draft that we can then go to select regions, ideally up to all 6 WHO regions, with a copy of the document, draft document in hand, and ask for immediate feedback from those end users. And based on that feedback, as well as the expert review process, we'll then go back into the drafting phase to revise 1, 2, or however many more times need to be done until we're pleased with the product. As soon as we've entered that final phase of dissemination, then we really start anticipating the need for launch events, publication planning, and long-term engagement. For those on the call, each of those phases, there will of course be a role if you're an academia or a researcher or an expert or part of civil society that wants to advocate. What I've listed in this slide is perhaps 6 or so sample activities in each of those different phases that may be relevant to you. So first and foremost, in this process of preparation for the actual drafting, please, again, you're most welcome to send any comments, questions, concerns, feedback, key message ideas to us. We welcome that. In fact, not only do we welcome it, we need it. So please view this as a shared document, and it's intended to reflect your needs and your priorities as well. The next step will be the review process. The drafting will go to the expert group, and that will be followed up with a review process, in which case, again, the cancer community will be asked to provide feedback on the draft, and also to begin the production of spin-off products, infographics, video messages, etc. As I mentioned earlier, we're planning those regional consultations. We invite you to attend, perhaps even coordinate or organize one of the regional consultations with WHO and IARC. And then finally, the dissemination phase. This really is where the success can happen or can be failed. What we're hoping to really emphasize here is a strong public, cohesive voice in cancer prevention and control. And this includes the launch events, as I briefly reflected on earlier in the World Report on Violence and Health. We saw that there were over 60 countries that hosted these launch events. It can be hosted by any individual and can engage any level of partners, from governments to WHO country office to the regional office or headquarters. Our hope is really to create a day, a month, a year of a cancer dialogue. And we invite you to be part of these preparations so that we can use this document as the beginning of the discussion within these partners to advance the cancer agenda further. But it doesn't stop within those initial launch events. Our hope is also to plan prolonged engagement in those settings. So yes, there perhaps may be a launch event in a country, but we could plan a follow-up engagement in 1 year, 2 years, or 3 years to see how are we doing. Are we actually following through on the activities that have been proposed? And really, our plan is that this is a report that not only lasts for 2019 in which it's published, but that 10-year time horizon that we had discussed earlier. So next steps and summaries. First and foremost, please continue to engage in the process. I appreciate you spending this hour with us. It's just the beginning of what we hope will be a much more extensive and rich dialogue. Your feedback is needed and most welcome. Continue to reach out to networks both internally within your organizations and beyond. And we invite you to join the listserv to follow progress. As Julie mentioned, we plan on hosting several more of these seminars as we make progress within the report. And I've also listed my email address if you have any ideas, concerns, or questions as we move forward. If we could summarize it perhaps in 2 brief points. First and foremost, this is intended to be a report that reflects all the needs and concerns of stakeholders in the cancer community. What are our priorities? If we can do so using a shared voice, we can produce what we consider a shared product. And in doing so, this will then set the agenda for us to mobilize to action together. And please, the process really is as important as the product. We do need you to be involved, and this starts today. There are new ways that we should be able to reach communities that may not have heard cancer as a very important public health priority, both within governments, donor communities. And how can we do this in a way that we see action in the end? Because a report is just the beginning. What we are actually trying to accomplish, lives that are improved, cancer that is prevented, or cancer that is diagnosed and treated in a high quality way and without financial harm. And through our collaboration, we think we can realize this. So thank you again for joining today and for the support, and we look forward to our next steps together.
Thank you very much, Andre. I hope all of us on the call now are energized to see how we can get involved, and it's quite refreshing to be having such a long perspective before the product's even there about how we're going to get it out to the community outside of our cancer community, and particularly I think also outside of the health ministries, trying to engage more government interaction on the issues of cancer. So we do have many different opportunities of getting involved, and I think the first thing to people on the call is, don't worry. If you've got a great idea for a launch event, send it to us. UICC will keep it logged. Make sure Andre doesn't forget. If you want to get involved in writing a part of a chapter, let us know. If you've got some ideas already of complementary products, send them out. Don't wait. Send them now. We will log them all and make sure that we keep this conversation going. As Andre said, this is the first of many calls like this. We will be following up after this call, posting the webinar. You can see the slides, so you can refresh your memory in a few weeks' time. But equally, if you'd like to right now, then really let us know now. And we'd like to set up a sort of common interest group that can keep tabs on where things are going and look to see how we can fill any gaps that are emerging. So I already see that Jim's saying count me in. So there you've got one commitment, Andre. And also Ophira as well. So 2 more authors to count in, which is excellent.
Yes,
so we're very grateful for all the help. You can see it's quite an ambitious report, but I think we're very excited to really make it a document that we can all use and harness in our daily work as advocates. So thank you very much to Andre for taking time to explain all of the steps to us. Thank you for all of you to join us today, and watch this space. We'll make sure we keep in contact with you and make sure this global report on cancer is one of the good reports that we can look back on in future years. So thank you very much.
Thank you.